What does it mean to be clinically depressed?
Depression is a spectrum of feeling sad or empty or numb, and so it ranges from a normal state that we all feel at times when we feel sad or feel empty, to a very severe state, which we call clinical depression. So clinical depression implies that a person feels depressed, which means not so much that they feel sad, but they feel empty or they feel numb. They have no feeling. They don't feel any pleasure. They don't enjoy things. Life is just dead and numb. They may lose their sense of self-worth, feeling good about themselves. They may feel guilty or self-doubt. In addition, they have what we call sometimes vegetative symptoms. So these are things like losing your appetite, not sleeping, having no energy, losing interest in sex, not being able to concentrate.
Well, there are a number of criteria that we look at to really define depression. And we'd look at things such as have there been, first of all, and most importantly, we screen for suicide. And has anyone attempted suicide, or they feel like hurting themselves? Some people might have chronic suicidal ideation, we call it, and some people have actually attempted. So this is the first thing we screen for. The next would be, have they lost interest in activities that normally give them pleasure? And the next would be guilt feelings. Do you have guilt feelings that you really shouldn't have? Next would be energy level. Is it up or down? Concentration, is it up or down? Appetite disturbance, up or down? We say psychomotor agitation, or is there body movement more or less? And the last thing is sleep. Is there a sleep disturbance? We add these 8 criteria together, and if you have 4 out of 8 of those, you're usually looking at a diagnosis of major depression. There's other types of depression, such as dysthymia in children, which could go on for 2+ years, of just a chronic simmering depression, and usually not with suicidal ideation, but it could happen. So there's a number of different subcategories of depression.
What are some things that might cause the development of clinical depression?
Neurological diseases can sometimes trigger depression, such as dementia or Parkinson's disease. If we're talking about biological causes in general, then there are many theories. The common ones that we talk about are neurotransmitter changes. Neurotransmitters are the chemicals that move from one nerve cell of the brain to the next to carry the electrical signal. And we know that the amount of neurotransmitter is decreased during depression. So, for example, a lot of people have heard of serotonin, which is a neurotransmitter, and that's decreased in many people, but not all people with depression. Sometimes other neurotransmitters like norepinephrine, also called noradrenaline, are decreased. Sometimes another one called dopamine is decreased. We don't know if that's a cause of depression or whether it's a consequence of depression. If we give someone an antidepressant, it will improve those neurotransmitter levels, but the improvement in depression occurs 2 weeks later. So it's not simply about the neurotransmitters. Something else is going on. We know that sleep affects depression, and depression affects sleep. There are changes in the brain structure. Some things are larger and some parts get a little smaller that are different. We know that genetic factors play a part. If there's a strong family history of clinical depression, a person is at higher risk of developing depression. But genetics by itself doesn't do it, but probably a combination of genetics and stress. We know that psychological factors play a role. If a person's very negative about themselves, that increases the risk of depression. If there are social problems, such as a lot of conflict or people oppressing you, that increases the risk for depression. Environmental factors play a part. Even the lack of sense of spiritual connection or purpose can play a part. So many factors can come together in depression.
How do you differentiate between clinical depression and just feeling depressed?
Do you just have the blues, or are you really, really sick with depression? The blues, you would feel down, you'd feel low, you might feel as though you don't want to leave the house, your appetite, sleep might change, but not to the degree that you would have a major depression.
Could you explain SAD for us?
seasonal affective disorder, what's characteristic about it is it's depression or mania that occur at specific times of the year. So generally, a seasonal depression will begin in October, November, and start to improve somewhere around March, April in most people. And then in the summer, their mood tends to be normal or above normal, and mildly hypomanic, we would call it, during the summer months.
Seasonal affective disorder, or SADS, it's been a controversial topic over many years. Is it its own entity, or is it really part of the depression definition? Meaning one person might get SADS, another person might get just the major symptoms of major depression. Today we accept SADS as a true component of depression. If you live in a northern area where you're not getting enough sunlight, and because the winter season is so long and the days are so short, the belief is that the neurophysiology, the sunlight is not hitting your eye and you're awake during the day. There appears to be some neurophysiologists who will say it's an actual current that goes from the back of your retina in your eye into your brain, creating a small charge and keeping the neurotransmitters at the right balance. If the day shortens, you're not getting the sun, you're getting more dark, and your brain is not maintaining its normal balance. It makes you more vulnerable to a seasonal affective depression. And that's really what SADS would stand for.
How might insomnia or hypersomnia occur as a part of depression?
Depression is associated with changes in sleep and what we call the sleep architecture. So through the night, we have different kinds of sleep waves on an EEG, on a sleep recording. Most people are familiar with REM sleep, or rapid eye movement sleep, which tends to occur mostly towards the morning before you wake up, when dreaming becomes more common. But in depression, REM sleep begins early on in the night rather than late in the night. So sleep changes seem to probably be a factor in causing depression, and depression is a factor in causing sleep changes, so there's a vicious circle there.
Any type of sleep disturbance is, again, electrolyte imbalance, neurotransmitter imbalance in your brain. And when you have a neurotransmitter imbalance, your sleep is going to be affected, which it's a chicken or egg phenomenon. First of all, if a person's not getting enough sleep or getting too much sleep, they could cause a depression if they're vulnerable to that. If you're depressed, on the other hand, looking at the other way, you usually do have some sleep disturbance, meaning too much or too little. If you don't get your 8 hours of sleep and practice good sleep hygiene, you will be more vulnerable to depression.
Could you explain psychotic depression?
That one's fairly easy in terms of symptoms. So a person has two sets of symptoms. They have depression symptoms, and they have psychotic symptoms combined. We regard psychotic depression as one of the extreme forms of depression, where psychosis is added on. But not every severe depression has psychosis.
Why might someone take on dissociative behaviors when they're depressed?
Why do people dissociate? Well, because in theory, you're dissociating to take your mind off the trauma. And sometimes you would dissociate from, as an instinctual part of your brain would dissociate to get away from that emotional, psychological trauma. It's the whole idea of why dissociation develops in these patients.